It's 8:41, live shot this morning from the Century Plaza Hotel and Spa on Burrard Street. If you have teenagers or a teenager in your life, this is for you. We want to know this morning, is the teenager just moody or depressed? And to help us know the difference, we have from BC Children's Hospital, Dr. Ashley Miller. Thank you so much for joining us.
Thank you for having me.
So let's stomp down first and learn about some of the qualities of traditional teenage moodiness, because that's probably the most likely case, yeah?
Sure. Well, I don't need to tell anyone about this, because if you have teenagers at home, you've probably experienced yourself. But if you think about a girl who comes home from school, she's sort of already angry with you when she walks in the door, rolls her eyes, stomps upstairs, so that's more your moodiness, or how we might see it at home.
And very rude.
Yeah, rude. You're like the worst person. You can do no right.
Okay, so that's normal teenage moodiness.
Yeah.
Okay, so when does it cross over into the land of depression, which is obviously more of a concern?
Yeah, well, if you have depression, then you're going to have either a depressed mood, so really low mood, or irritable, grouchy mood, but it's not just going to be that one point in time or just with your parents. It's going to spill over into interactions with your friends. It's going to maybe show up even at school, and it's going to be persistent, so over most of the day for several days in a row, at least 2 weeks.
At least 2 weeks. I think that's a really important thing to remember, right? Even as adults, you think, wait, how long have I been in this funk? Is that the same for adults?
Yeah, so you just need 2 weeks for kids and teens, 2 weeks for adults.
Okay.
If you have sort of a mild or long-term depression, then that kind is actually a full 2 years for adults and only 1 year for kids. But that's not what we call major depression. That's sort of a chronic, lower grade depression.
So let's say, you've seen a change in your teenager and you think that they're starting to drink or dabble in drugs, which some teenagers do. How do you know if that is actually a symptom of depression, that they are trying to medicate themselves somehow?
It's a really good question, because of course teens do experiment. That's where you want to look at the bigger picture. So you want to connect with your teen, have some sense of what's going on in their day-to-day life. Are they still going to school regularly? Are they hanging out with friends regularly? If you're starting to see changes in how they're functioning in their day-to-day life, then you need to worry more about a new pattern of behavior, like substance use. And especially if the substance use seems to be causing them problems, then whether it's depression or not, it's something that's worth getting looked at by a health professional.
So can we talk about how to talk to our teenagers then? I have 2 kids. I've got Ozzy, he's 5. I've got Vi, she's almost 9. I'm learning right now that there are good ways to talk to a child or a teenager, and there are ways that are really ineffective. So how can we broach a conversation to our teenagers about depression? Do you use the D word right off the bat?
Well, I think you want to just make sure you have sort of basic conversation going first. It's hard to sort of march in with a big ticket issue. So going for car rides or walks, kind of lower key, maybe you're watching a show together and there's a character who's depressed, and you can sort of talk about it a little bit in a casual way. And you can just sort of ask how they're doing in general. How are their friends? How's school? But we all know that teenagers are sort of allergic to a parent putting a lot of pressure. So you want to really take their perspective and be ready to listen non-judgmentally. As soon as too much of yourself gets in there, your own anxiety as a parent, your own judgment, they're gone.
So you say, as too much of yourself in there, but it is a good idea to use your personal experiences from when you were a teenager?
It sort of depends. So what we want to do is really acknowledge our child's feelings, our child's experience. If you go too quickly into, well, I remember when I was a kid.
It's all about you, Mom.
Yeah, exactly. So you can sort of use your experience maybe at a different time when they're not really upset, especially if you're modeling the fact that you used to mess up in certain ways. You don't want to tell them the worst of it, but sort of appropriate to help them feel less embarrassed.
And you mentioned a moment ago car rides. I'm finding my kids, again, are pretty young, but that is such a powerful time to talk to your kids when there's not the distraction of a phone and the screens, yeah?
Yeah, absolutely. They're sort of captive for a short period of time. It's not intense because you're not looking right at each other, and you don't have the distractions.
Hey, so you have a really special event tonight, yeah?
It's a great event. Yeah, it's the 10-year anniversary of the Kelty Mental Health Resource Center, which is kind of a one-stop shop for information about everything to do with mental health in children and youth. And it's for parents, educators, and really anyone in the community, service providers. And so tonight they're hosting an event, and it's being webcast throughout the province. People can sign up free, and I'll be speaking about depression in youth.
Well, thank you so much, Dr. Ashley Miller, straight to us on BT this morning from BC Children's Hospital. I hope that information was valuable to you, and we'd love to hear about it online or maybe even a private message. We're here to help you.